When we look around at other provinces who feel that, they're kind of already entering this new phase, almost of endemic response, is British Columbia an outlier? How long do you see this transition we're undergoing right now to last?
I don't actually think we're an outlier in any way. The measures that we took were not the same as some other provinces. We're right on track. We've removed all of our capacity limits and things like that, for example, on a number of different settings. So there are a couple of fundamental pieces that we still have in place, and we've been looking, for example, for mask mandates, and we've been looking at what are the natural transition times and what amount of transmission in our community means that these additional barriers are not as needed as they are when we have high rates of transmission. One of the really important natural breaks that we're seeing and is looking really optimistic is spring break for K-12, and that starts on March 14th. So I think across the country we're quite aligned on having some basic things in place. Different provinces and territories have used things like their vaccine card in different ways. It is an important tool that is still having really important effects and is in play here in BC still. But those are all things that are additional layers of protection that as transmission comes down, as our hospitalization comes down and the risk in the communities changes, we can shift more to individualized personal management. And, all of this is aligned with having new vaccines available, the high level of immunity from people stepping up and getting vaccinated in BC, and extra tools like having the at-home tests that people can use to help guide their own actions over the next few months. But really it is preparing us. We are, and we've had this discussion with my colleagues across the country even this morning. We are in a transition phase. We do not yet know enough about this virus from an epidemiologic point of view for us to consider it endemic. That presupposes that we know the patterns that we're going to see through respiratory season. We have a pretty good idea now, but there's still a lot of this virus circulating around the globe, so there are inevitably going to be changes and surprises that we will need to adapt to.
And now over to Minister Dix.
Just to say that I think our approach has been founded on the advice from the Provincial Health Office, from the BC CDC, and has been, I think, compared to other jurisdictions, not just in Canada but around the world, the most consistent approach. That has meant that for children in schools, they've had the most opportunity to be in school of all the jurisdictions because we've taken a consistent approach and have had the remarkable work of not just people in public health, but of teachers, the support of parents and the children themselves. I think our approach has been consistent in while it may not feel this way living in British Columbia all the time where measures change, we've had the most consistent approach to public health measures, and that has led in part, I think, in addition to the contributions of British Columbians, the most significant adherence to public health measures, because it is the adherence that's been the most important thing. People in BC have pitched in, and it's been exceptional. We have some of the highest rates of vaccination in the world. These are parts of our approach, and there are some differences at times between jurisdictions. British Columbia was one of the first with the BC vaccine card, the first to implement it. We're the jurisdiction in Canada, or one of the jurisdictions in Canada, one of the largest jurisdiction in Canada that has, and we have benefited from this extraordinarily during this most recent wave of COVID-19. All of our healthcare workers in our facilities vaccinated. So we've been consistent and thoughtful. I think the response from the public has followed that to a great degree and has supported that. That's something that we've all done together here. This isn't a common on other jurisdictions. This is what we've done here. We've dealt with this as our pandemic in BC. It's affected regions of British Columbia differently and at different times, but we have, I think, supported one another in an exceptional way. So I'm pretty proud of British Columbia, and we're going to continue to follow that approach as we deal with this next phase of the pandemic, which still, of course, exists and still affects people in our hospitals and our communities.
Next question comes from Binder Sajan, CTV News.
Hi, Dr. Henry. I just want to clarify something that I thought I heard you say, which was that there could be additional precautions this spring. I know you're talking about lifting restrictions, so I was a bit confused about that. Could you just let me know what you were saying there a little bit earlier?
No, I was talking about the layers of protection, and as we have decreasing risk, that they're no longer needed, but that we need to pay attention to next fall, because we know there will be respiratory virus resurgence, and we've seen that there's a pattern to COVID as well. So we may need these additional layers of protection again as we move into next fall. So if I said spring, that was a mistake. I'm talking about next fall and winter.
Binder, do you have a follow-up?
I do, thank you. And Lisa, I know kind of touched on this too, but what I'm hearing, and I'm sure you hear it too, from people is they look at other provinces who are, lifting mask mandates, vaccine mandates, et cetera, and say, what's different about BC here? And I know we've talked about, and we've heard you talk about how the restrictions have just been generally different. But can you tell us in terms of the science, is it science? Is it politics? Why are things a little bit different here in BC?
Yeah, it's probably everything about that. It's how we have used what we've done. And I think if you look at actually what is happening in provinces and you put it down and you look at dates and you look at what's happening where and what restrictions are in place, we're all very much aligned. So things that are announced that are happening at a time in the future, it's a way that some people have been working through this. And, what we've done is given a timeline for when we're revising things. We've had the layers of protection in place in the settings where they're most at risk. And, if we look at the BC vaccine card and where we've used the BC vaccine card, it has been focusing absolutely on those highest risk indoor settings in discretionary settings. And so it has a really important role in helping build confidence going back into those settings as we've come through this wave. And we know that it does reduce risk to have only vaccinated people, because we know that over 60% now of people who are vaccinated have had their booster dose, and that reduces risk of transmission. So yes, we are following the process that we've been using, and that is slightly different than how other provinces have used their vaccine cards. So it's all the same science. It's how it's been implemented and where we've been using things, what restrictions are in place, when and where, that have varied a little bit between provinces.
Thank you. And now we'll be coming back to Minister Dix.
What's the same in BC is the same approach, following what we see in the pandemic here in BC, led on the epidemiological side by public health. And of course, so it's reasonable to ask what's different about BC. One might reasonably ask what's different about other provinces. I don't know if that's the important question. I think people generally are going in the same direction. But what's been different about BC and what's remarkable about BC, I think, is the outcomes, which generally have been very good here compared to any other jurisdiction in North America. First of all, just let the bell ring. The outcomes have been very good, and I think our response has been consistent. So it's not a race of a few days. I think one province just announced changes today. And so we're going to continue to follow the same approach, and I think that's what people in BC want. They want, we've had, in many cases, relatively fewer measures, more consistency of measures. And so whether it happens one day or 1 week in one province and one day and 1 week in another province isn't the important question. I think the overall approach continues to be the same, continues to be led by the response to the pandemic and the need to support public health. And I'd say this one thing finally. While we have less than half of what we had the people in hospital that we had with COVID-19 at the height of this wave, we've still got a significant number of people in hospital. We still have people affected in our healthcare system, as you see in the numbers. So we continue to have to be cautious, and that's why you see a thoughtful, balanced approach that has been, I think, supported by public health from the beginning here, and you're going to continue to see it.